this hospital is created under legal duties. Anybody dreaming of returning the hospital maybe to the university, I think is misplaced. We must be able to look at, this is a saga in the Ministry of Health. So if there is any working relationship, it should be looked in that direction. That is a saga under the Ministry of Health, and it's going to exist that way. So any fights towards saying that we want this and that, and we're in the same government, it's one government, it's not a different government. So we would want to encourage people to, let's have discussions on how we can coexist. This hospital as a saga and the university as an institution. You also have CDC here, you have WHO which are here. So we look at how this family can exist and work in a harmonious way. And please, even as a saga, which we are the ones oversighting, you have no business about the existence of this saga going to discuss with another body, because you are legally mandated under the legal notice that created you. And we are in the process as a committee working on the amendment of the Health Act so that we can anchor you in law. All the national referral hospitals, we want to anchor them in law that will govern them.
Future chair, I think it's good for the committee to know where the hospital is headed in the next 10 years. We are thinking once we stabilize, this hospital could get to maybe 1,500 beds. And also, we are hoping, it's just a dream chair, that maybe we can come up with a manufacturing plant, because the medicine, our biggest budget goes to the medicine. Is it possible? Is it something that we can think about? And also, construction of accommodation facilities here for doctors, students, and other staff. So this is a dream chair that we are hoping that the committee can also consider.
I really want to appreciate and encourage you for the good work you are doing. This is from our visit.
We interact most of the times during the budget and just the staff, because we are not 100%. Also, thank you for allocating. So we request that you also support us in getting that 150 million for integrated molecular imaging, that project once and for all. So that is for the asks. Briefly is we're seeing as the other referral hospitals, we are struggling with the number of been in operation. We had waived 250 the services they require, and they walk out of here because we are not able to detain them or anything, because they are.
Of KUTLIH and the Kenyatta Hospital for a very long, and this hospital for a long time. And today I expect the issuance and follow. Secondary chair.
PET CTs, and once the PET CTs are procured, we are able to.
The hospital was a very good plan, because I was in, all of us were in Kenya.
IMIC, we are able to produce those isotopes, and that conversation is still going on, that MOU. But we will be also reaching out more to other county governors who bring these medical students here. As you can see on the screen, we've started this conversation way back in 2020, signed an MOU,
On your request about the next generation sequencing machine, the committee will be able to work on it. And if our budget will be able to allow, we should be able to do it in the next budget. LINAC, I think that one we will be able to look at our budget and make sure that we are able to purchase it, because having patients, the panga is ready, and having patients waiting for 6 weeks is not acceptable. That one we will be doing disservice to Kenyans. And I know, and I want to really thank the hospital for the way for which you've extended. Now that you'll get the money, the 100 million for the children's hospital, please start it. We'll make sure that in the next budget, I think we put money. We'll be able to put money into it, and we want to build it in phases, so that we can do one phase, we do like that, until we are able to finish it. So we'll put money in the children's, we'll put money in the LINAC, we'll see if we can also squeeze something to get for the next generation sequence. I think for me, those three will be priority in our next budget.
And we took this opportunity to tell members of parliament in charge of health our challenges. And one challenge that we explained to the members of parliament in charge of health is about the children's hospital, which has stalled. That hospital was started about 6 years ago. It has not continued, and we have requested members of parliament to please give us that money so that we can finish it. It's about 6 billion, and I'm happy to report that members of parliament have said from next financial year they will put in money so that we can build the hospital in phases. We may not be able to get all the money to build it in 1 year or 2, but they will give the money in phases starting next financial year. That's a promise that has been made by the members of parliament. They have also listened to our request to buy us a LINAC machine. As I've explained before, we have one LINAC machine where we are treating 115 patients a day. And still, patients are waiting for 2 to 3 months. So we have explained this to members of parliament, and they have actually understood the problem, and they have also promised to buy for us that LINAC machine. We have also explained to the members of parliament about the need for a machine. I think you have heard me talking about it many times. It's called next generation sequencing machine. This is the machine that is able to establish the genetic makeup of the cancer, so that when you are treated, you are being given medicine for the right cancer. We are not able to do that in Kenya. We normally send the sample to South Africa, and we have requested members of parliament to give us money to buy this machine so we can start doing the genetic mapping here. And I'm happy to report that the members of parliament in charge of health, they have approved that they are going to give us the money for that machine. So it's a good day for us. We have worked very well with the members of parliament. They appreciate the amount of work we are doing here. We have even also told them that we need more staff, because we told them that the money we have we are not able to hire as many people as we would want, and yet the hospital is expanding. So I'm happy to also report that the members of parliament have accepted to give us more money so that we can hire more staff. That we will be able to give even better services to Kenyans. So it's a good day for us. It's a request, colleagues, that I made, and I think it's a good request, because already the government has pronounced itself that this is a parastatal, and KU is also a parastatal. And even though this land, actually, this hospital is built on KU land, because the idea came up when we were in KU. We requested, and the members of parliament said they will consider that we get the lease for where the hospital is. Because I think that would be the best thing. Otherwise, if we don't do that, it will always be an audit query, because we built the hospital on the KU land, which was okay, because the idea came when it was part of the hospital. So I think that separation eventually is important. I don't think the request is that we get a title deed. The question was, can we get a lease, just like we have given the WHO and also the CDC? And they said they will consider that request.